Hello and welcome. I'd like to start by saying that I think each one of you in this room today is remarkable. And I'm not just saying that because you decided to come hear me speak, even though that does factor into it. I think that you're remarkable because when I look at you, I see that you're the manifestation of hundreds of your ancestors' hopes and dreams, their decisions, their choices, the environments that they lived in, and the tools that they developed to live in these environments. That's what makes you remarkable. To get to you today, you had to have two parents who themselves had two parents, who had an additional two parents, which brings you to 8 great-grandparents, 16 second great-grandparents, 32 third great-grandparents, 64 fourth great-grandparents, and it goes on and on. You're so remarkable that your history itself follows a geometric progression. I know I've thrown a lot at you, and I promise that this isn't going to be a math lecture. I'm not qualified in the slightest bit to give one, but this is going to be a talk about patterns. Specifically the generational patterns that we have and the inherited stories of resilience that we derive from our ancestors and how we can incorporate these in our day-to-day lives. Even though I'm not a math expert, I do love science. And at Duke I have training in both biology and bioethics, so I've always been fascinated in this concept of the intersection between science and society. In biology we have this concept of epigenetic inheritance, and it explains that things that we encounter in our day-to-day environments have very real and physical impacts on our genetic makeup. Negative things we encounter in our environments like chronic stress or smoking or excessive drinking can actually impact your DNA on a genetic level. At this molecular level, you have these changes that are heritable. They can be passed on to your children and your children's children and their children. But research also shows that positive traits we develop like resilience have protective effects on our genomes. And these positive traits can also be conferred to future generations, going to your children and your children and your children's children. I think an anecdotal example will help us better explain this. When my mom was pregnant with me, for example, the things that she encountered in her environment influenced my development as a fetus. But as someone with a uterus, while I was developing, my body was also developing all the eggs that I would need to one day reproduce. And so while the things in my mother's environment, like positive things or negative things like stressors, impacted my development, they also had an impact on the development of my eggs, meaning that my mom's actions had an impact not only on her children, but her children's children, her grandchildren. Our ancestors impart to us these genes that tell the stories of the environments that they lived in and the tools that they developed to successfully navigate these environments. While you may be living with some of your ancestors, it's likely that you don't exist at the same time as them. And so how are our lives shaped when we return to these same environments as our ancestors? We find that the driving forces of our past become intertwined with the eventual outcome of our destinies. That's a heavy question, but I'd like to explore it with my personal relationship with Duke University. My grandmother was born Geraldine Johnson in Bladenboro, North Carolina, which is a small rural community in the eastern part of our state. This is the house that she grew up in. She was the 7th of 10 children born to my great-grandmother, Marie Hester Johnson. Marie's husband worked as a traveling painter, and so she had to provide for her family by herself. In order to do that, her family worked the 10-acre farmland that they lived on and grew crops like squash and corn to support their everyday eating. But they also grew tobacco as a way to bring in money to support their family. Even though the Johnsons owned 10 acres, they were only allowed to farm on 3, and that's because they were sharecroppers. Sharecropping replaced the plantation economy in the United States following the collapse of slavery and emancipation. Sharecroppers like my family grew cash crops like sugarcane, tobacco, cotton, and rice. Even though families like the Johnsons may have owned their own land, other families couldn't afford to because hundreds of years of slavery left them destitute and in cycles of inescapable poverty. And so they oftentimes, sadly, had to return to empty plantations and work for former slaveholders. To work the land, they had to borrow tools like mules and tills on lines of credit that they were never expected to pay back, further deepening the cycles of poverty that they lived in. And they worked long hours in harsh conditions for very little reward. My grandmother herself tells me that sometimes she would only earn $2 per day. The tobacco that my family harvested was eventually bought and sold by the American Tobacco Company. Some of you may recognize this as a company founded by James Buchanan Duke, pictured here, the founding benefactor of Duke University. He was the same one who endowed the university with the large sum that allowed it to become from Trinity College to Duke University, moving it from Trinity, North Carolina to Durham, North Carolina, and naming the university after his father, Washington Duke. For me to descend from sharecroppers, especially as a Black woman in the South, is not necessarily a remarkable narrative. But my grandmother's dual connection to the university is uniquely special and important to me. Beginning at age 6, she would make the long journey from Bladen County, North Carolina to Durham County, North Carolina, and seek care from Duke University Hospital, which had opened only 11 years prior. She recalls spending up to 8 hours a day in waiting rooms just like this one. Unlike other hospitals, which initially opened to serve white patients and later expanded their services to Black ones, Duke University Hospital actually opened as a segregated institution, with one part of their clinic and services for white patients and the others for Black patients, cementing this idea of segregated care standards. She would have to wait for hours for white doctors to finish serving other patients until they could tend to her needs. When my grandmother wasn't waiting in these waiting rooms or sharecropping, she was attending the North Carolina School for the Negro Blind and Deaf in Raleigh, North Carolina. And so she oftentimes told me about, on breaks from her schooling, she would have to journey on the back of a crowded, segregated bus, making the journey down the aptly named Tobacco Road from Raleigh to Durham to seek follow-up care. From being a child sharecropper to being a pediatric patient, my grandmother was doubly dependent on Duke University as an institution to support her life. This is the same institution that only 72 years later, her granddaughter would step foot on as an excited freshman ready to begin her journey, blissfully unaware of her history. I say I was unaware because I didn't even learn about her connection to the university until I was already a junior at this school. My grandmother had a very tough childhood, but she was even tougher. And she survived because she had to, because her family had to. She knew that one day her daughter would have to, and that her granddaughter would have to, that I would have to. Earlier in this talk, I posed a question, and it was a rhetorical question, so none of you responded, though I'm sure you're just trying to be polite. But it's important, so I'm going to restate it. When we return to these same environments as our ancestors, how are our lives shaped when we see that the driving forces of our past become intertwined with the eventual outcome of our destiny? If you take a look around you and notice where you're sitting, you'll remember that you're sitting on the campus of Duke University in its 100th year. And during Duke's centennial, we're uniquely poised to reckon with this practice of remembering our past so that we can properly contextualize our futures and reimagine a history that's rooted in both intentionality and context. While I have the benefit of learning about my history, my story itself is still being written. But when I think about this inherited resilience that I gained from my grandmother and from my great-grandmother, I'm reminded that even in the spaces that I encounter, whether my people have walked in them before or I'm in them for the first time, that I can expand access for people who hope to walk in my footsteps. After my grandmother finished her studies at the North Carolina School for the Negro Blind and Deaf, she went on to Howard University, where she earned a major in elementary education and went on to work for over 20 years in Raleigh, North Carolina, and Washington, D.C. as an educator. This July, I will return to that same university as I begin my training in medical school, after which I hope to become a health law advocate so that I can work to dismantle the same systems of oppression that still to this day allow people like my grandmother to sit for hours in waiting rooms cast aside, feeling like their care issues don't matter to their providers. When I think about the stories of resilience in my family and where I'm going, I'm reminded that when I finish my studies, I'll have two alma maters, Duke and Howard. The term alma mater, derived from Latin, actually means nourishing mother. And so I think about these nourishing mothers, these presences, these mentors, people in my life who have pushed me to walk in the same spaces that they have and to do more and to be more and expect more from life. When I think about nourishing mother, I'm particularly encouraged by the memory of my great-grandmother, Marie Johnson Hester. Her name, in some translations, means wished-for child. And so when you exist in these spaces, you may consider yourself a nourishing mother, a presence who pushes people to do more and to be more, or you may be a wish-for child who's walking in the memory of your ancestors and working to expand access so that people can follow in your footsteps. regardless of the position that you take, I encourage you to remember the power that's in your history. When I started this talk, I reminded everyone in the audience that they are something, and that is remarkable. Your history is remarkable, your story is remarkable, and you are remarkable. Thank you.